Physicians have long referred to the mouth as the gateway to the body, and the working relationship between the two cannot be understated, which is why growing data points to the importance of proper alignment. According to recent industry statistics, 80% of people have some type of jaw misalignment. In 20 to 30% of the adult population, this pain and dysfunction of the muscles that move the jaw can lead to temporomandibular joint dysfunction, or TMJD. TMJD can lead to a myriad of symptoms, including headaches, migraines, ear pain, neck pain, facial pain, and unstable bite, to name a few. Although not life-threatening, TMJD can be detrimental to quality of life because the symptoms can often become chronic and difficult to manage.
People need to be aware of a misaligned jaw and what it can cause. The importance of the body alignment starts from the head. The head sits on top of your cervical vertebrae. Anytime your jaw moves, the cervical vertebrae are engaged. If there's some misalignment or some tilting, then you're going to get pain in the back of your head. You're going to get pain in through your shoulders, and a lot of people don't realize that the pain is connected to the way that the jaw is aligned and the way the teeth come together. And that's why a neuromuscular dentist will help you connect the dots, help me to help other healthcare professionals and patients understand the connection and get to the root of the problem.
Medication or surgery.
It's our job here to go beyond the tooth-by-tooth dentistry, to really dig in and find out what is going on and how to make it right for you. We'll look at everything from head to toe to make sure everything is balanced and even. Here we utilize the ALF-10s by Myotronics. It gives stimulation to the muscles of the head and neck, relaxes them so the patient can unwind and we can start to see a good physiological rest position of those muscles. K7 is another instrumentation that we utilize all the time here too. We're able to look at muscle activity, the EMGs of the muscles, how they're firing, if they're even able to fire or are they too fatigued. We're able to look at joint sounds, how the jaw moves. We're able to track the opening and closure of the jaw, and it gives us a good foundation to make our diagnosis right. We also utilize the CBCT scan, which helps us see the jaw in 3D imagery. By implementing all of the technology that we have in our office, we are able to have a very high success rate of over 90%.
Often the last resort for frustrated patients that have been to countless other doctors for help.
I was in a horrible automobile accident over 50 years ago. Over the years, my jaw was aching terribly. I couldn't sleep, I had backaches, earaches, and Dr. George said, looking at your scans, I'm almost positive that I can help you. After so many years of not really being able to chew your food and fracturing your teeth, it was such a relief to finally be able to eat almost anything you wanted to. The final step for me is to have my bite permanently fixed so that I'll be able to have a much better quality of life.
I went to other doctors for the symptoms that I was having, but the doctor tests for one thing, and when that test comes back negative, they don't take it to the next step. So when I came here to Dr. George, that's when I recognized that all of these things are related to my jaw. And she treated every single symptom that was on that screen that I saw and really drilled down to what the root cause of my issue was and solved that issue. No pain, no surgery, no meds.
People like me, people that have been trained in neuromuscular dentistry, they're out there. You need to find them, you need to get help, and you can change your life and get your life back.
If you're living with TMJD, there are treatments available to alleviate your pain without pain medication or surgery. Learn more today about neuromuscular dentistry.